I'm talking to Dr. Richard Schaefer, who treats Dupuytrens and Lederhosen by using radiotherapy. Richard, can you tell us, can radiotherapy be used after surgery, and is it still effective?
That's a really good question, Adam. So you know, as I'm sure you know, radiotherapy mainly is used in the early stages of Dupuytren's, where there's early progressive disease, whether you either got no contracture or a very small contracture. But you know, in real life, that's not the only people that come through the door, and you know, these are really important questions. So we'll split it into a few categories. The first thing is to say, you know, if you've had surgery before, so in other words, you had a contracture, it's been released, then there are two circumstances. Number one, is it worth giving surgery, you know, years down the line if your nodules start to grow again and your fingers start to tighten up? And the answer is, in my view, that this is very similar to someone who's got early disease. Because why do we give it for early disease? Because the disease is biologically active. Clearly, it's progressing. So, in other words, in this situation, you've got more nodules or tightening, and therefore it makes sense to give radiotherapy. You know, it doesn't. You know, I don't really think it matters necessarily whether you've had surgery before. And you know, to put your mind at rest, you know, I don't think there's any suggestion you get more side effects or complications or anything from radiotherapy. So if you've had radiotherapy quite some time before, I think you know, the answer would be yes. Perhaps the more difficult question is, how about if I have surgery and then have radiotherapy very soon afterwards? So why would we do that? Why would we suggest that? Well, you know, surgery can be a very good treatment for someone who's got an established contracture. So in other words, you release the contracture, and that can either be with fasciectomy or needle aponeurotomy, or in some cases with collagenase or Xiapex injection. So, you know, well, if you've released the contracture, why would you want to give radiotherapy afterwards? It doesn't really make sense. Well, the reason is because those treatments aren't 100% effective. So, for instance, after a fasciectomy, full-on proper surgery, it might be a 40% recurrence rate. After a needle aponeurotomy, it might be that recurrence rate is quite a lot higher. So people think, well, you know, in that case, if there's a risk of it coming back, I want to have my treatment and give myself the best chance of the contraction not coming back. So is there anything I can do? And so people often ask about radiotherapy. If I have my needle aponeurotomy, let's say, got a contraction like that, have the needle, releases the contracture, how about if I have radiotherapy afterwards? And I certainly have had some patients who have asked that question, and certainly some people who I have done that to. The thing is, there's not really anything in the published literature which tells us about the evidence to show that it definitely works. So it seems to me like a very good idea, and there's no reason why it shouldn't be safe. But actually, we don't know what the effectiveness is yet. Personally, I've treated probably, let's say, 10 or 15 people in various circumstances, so with needles, with after Xiapex, after surgery. So it's a very sort of mixed group, and also their follow-up time is mixed. And so, you know, I actually did look at those groups, and it didn't seem to me that I could really say anything meaningful. Anecdotally, I can say it's definitely safe. You know, but whether it's effective, really, we just have to wait for more results. I'm hoping to do that, you know, look at those results with another German colleague, and hopefully to present those reasonably soon. But at the moment, I can say in terms of the effectiveness, we don't know, but it definitely has intuitive appeal. And at the moment, also, it's being tried out in a large randomized controlled trial in Australia. Exactly that. You give surgery or needle or Xiapex, and you do radiotherapy very, very soon afterwards. Personally, if someone has a fasciectomy and they want radiotherapy afterwards, which I've certainly done in circumstances where people have had surgery and recurred, and this is their second surgery, let's say, or their third surgery. So if that happens, I tend to wait till the scars are fairly well healed, let's say 3 or 4 weeks afterwards, to see the patient, make sure that's the case, and then we get on with the radiotherapy. With the needle, I would do it, you know, as soon as you like, normally, let's say a week afterwards. And that's really because the fasciectomy, I worry a little bit about healing, about whether radiotherapy is going to impede that healing. Actually, there's some evidence to show that's not the case, so perhaps we can be a little more vigorous, but that's certainly my practice at this point.
Thank you.